So welcome. Thank you for coming to my workshop. I truly appreciate it. I'm really excited to share with you about some unique opportunities. My name is Laura Biewer. I am a seminar instructor for the NNA in California, Northern California. If you ever call the hotline, you might get somebody called Amazing Laura. That would be me. Just call for Amazing Laura and you'll get me, and I'll take care of you. I don't care what state you're in. I take care of all 50 states. I run my own business called At Your Service Mobile Notary. I've been in business almost 16 years in Modesto, California. I've performed just over 30,000 notarizations. I go through a journal about every 6 weeks. Besides notarizing documents directly myself, I have a private coaching business called CoachMeLaura.com, and I coach notaries across the United States who are trying to be in the business of being a notary. Now today, I'm going to talk to you about some opportunities in the area called facilities. And there are a lot of different kinds of facilities, and I'm going to put a slide up here in a moment that will name them all. But primarily, I'm going to talk about medical types of facilities and then jail types of facilities. So I don't know about you, I get paid to go to jail. And it's pretty good pay, let me tell you. And I even get to get out. So they let me out to come here today. All right, so my objectives today for you are this. One is I want you to understand why facility assignments are so lucrative for us and how to build relationships, how that gets started, because that helps you know how you're going to get hired. And then how to develop a plan of visibility so that if you say, hey, I want to go to jail too, I'll do that. Well, how do you get hired? How do they know you're available and you're willing to go? So here's my roadmap. Why facilities need mobile notaries. That's where we'll start. What kinds of facilities need notarization work going on in there? What are the most common requests that I get? What skills are important? When you go into a facility, there may be additional skill sets you need to be successful in that environment. There may be special accommodations and or tools that you need besides your notary bag. And then there are different approaches that you might want to be looking at, so we'll talk about that. That's a little bit in the marketing end. One of my best stories about being a mobile notary, I'd only been one maybe a year or two. And of course, I have magnets on the car. I have big phone number on the back of my Prius, right? Call me, I'm ready. And I get a phone call. This is before the hands-free stuff. And I get a phone call, and at your service, mobile notary, and he says, yeah, I need a document notarized really soon. Can you help me? And I said, well, you know, I'm on my way to Fresno right now to teach a class. I'm going to be there all day. Are you going to come through Fresno? He goes, well, yeah, I'm going to go through Fresno, over the grapevine, down to Southern California. And I said, oh, well, where are you now? And he goes, behind you. So we were driving down Highway 99. And I look behind me in the mirror, and there's this big rig following me. And he said, yeah, couldn't we just pull over on the side here and do it right there? And I'm thinking, oh, I don't know about that. Okay, you know what? Let's look for an ARCO. And like 2 exits later, we pulled over into the ARCO, and I pulled out my clipboard, back of my car, took care of him. Cash, it was my lunch. Yeah, and he was excited because he hadn't gotten it done, and now he was driving to Los Angeles, and he wasn't going to have an opportunity. Yeah, so hey, that's mobile, right? That's mobile. All right. So first of all, why did I turn to facilities? When I started in 2004, I could not be available enough. All I had to do was pick up the phone, and the job was there. What did I want? What time can I go there? It was you fogged a mirror. You're qualified. There was no certification, there were no background checks, there was nothing going on then. And I was so busy. I had another business. I ran a facility for elderly, and that's why I became a notary in the first place. But sometimes, you know, all your beds aren't filled. And when you have a 6th bed, it takes 5 beds to pay the bills. You don't make money till the 6th bed. So whenever I didn't have a 6th bed, it was kind of tight. So my friend put herself through law school doing loan signings and said, why don't you do it too? And that way you can stay afloat. And then I found, God, this is a lot easier than running a facility for elderly. The pen is so much lighter than picking up these patients. So I transitioned and I sold that business and decided I'm going to do this. And I went to an NNA conference in 2005 was my first one. There were like 2,000 notaries there. It was in Vegas. It was just like blow your mind, really. I couldn't believe it. And I found out all these different things I could do being a notary. And the first one was this NSA stuff. And I was like full on, 100%. That's what I did because it was a big money maker and I was just, and you know, back then we didn't print documents. They were shipped to us, right? E-documents was like a new thing. That was new exciting technology for me. It was like before there was a smartphone, before I had to like draw out my map and put the steps on where I was gonna go. That's what it was like when I started. I did not have the tools that we have. There was no social media. I mean, there was like nothing going on. And then after the big crash, you know, in 2008, I realized, you know what, this industry is too volatile to be the only stream of income for me. I need lots of different streams coming in, and what I'm going to do is leverage my commission every way I can. Even if it means I don't need to notarize, but they want a notary to do something, right? So some things are what I call complementary to being a notary, and it's the mobile part that helps. The reason I went into facilities is I had that background dealing with patients, and sometimes, you know, when you have a 6-bed, your patient goes in the hospital and they come back, and so I got to know the people, the nurses, the social services department. I started to get to know staff at there are 4 hospitals in my town, and I got to know them because of my interaction, and there was like a professional networking group of hospital administrators and social services, and they said, hey, why don't you come? You know, you've got a facility. And so I did, and I really got to understand the issues that they faced when they had outside vendors coming in, like notaries, although I wasn't thinking of it that way at the time. And I thought to myself, you know, I think I could be the preferred notary for them because I understand the environment, the restrictions, and the issues that they face having people come in and provide services while people are there. So that's where I got started and said, you know, I'm going to just start transitioning and do more of this. Because what I found is, you know, they can't go to the UPS store, they can't go to the bank, they're stuck where they are. And they need these documents right away. Usually they're advanced healthcare directives or powers of attorney financial, and they need to get things done. I found that, you know, this is pretty good. I go in, I don't print anything, I take care of business, it might be 20 minutes, I get paid now before I leave, and out I go on to the next one. I don't have to stop at the UPS store and drop docs off. I'm not faxing is what we did. Now it's scan back, right? Document. I didn't have to deal with any of that. Nobody was yelling at me, where's the package, right? None of that was going on. And so I thought, you know what, I'm going to move in this direction because everybody's becoming an NSA. Nobody's really doing this. So why not be where nobody else is, right? A lot less competition. Of course, now that I've let out the secret, you might go out there and start competing, but that's okay. So these clients are either too busy to get out of their office. Those are like the admin side of the hospital. So I do a lot of work with doctors who need recertifications and technicians. You would think every hospital would have a notary. Most of them don't, some do, and they're restricted when they do. And sometimes they'll take care of patients, but they're not going to witness, they're not going to do powers of attorney or trust documents. So there's so many restrictions, there's a lot of opportunity for us. Facilities are right in our own backyard. I don't have to drive an hour to get to a hospital, right? In my town, and I'm in Modesto, 200,000, it's not that big to get from one end to the other end. And I've got 4 hospitals right there. Plus, I have a whole lot of other kinds of facilities. And of course, I love the fact that I don't have to prepare documents. I don't have to take them anywhere. I just show up and get the job done. So let's look at all the different kinds of facilities that I might go to. Of course, hospitals, number one. Now, hospitals, I want you to think about their acute care settings. So people go in, it's a big deal, they're there for a short time, hopefully it gets fixed, and they leave. Then you have acute long-term care specialty hospitals, not long-term skilled SNFs, but they're hospitals, and these are for people who, whatever the issue is, they're hooked up to machines and they're not coming off. Or if they are, it's going to be 6 months later. And so these are hospitals where they go to where they have to have medical care just like they would in a hospital. And then there is a rehab where somebody, they break a hip, they go, they do the rehab, they might be there 6 weeks, and they come out. And some of them are actually combined with what are called long-term care or SNFs, where people they're practically living there. They're going to be there a long time. They're seniors usually, and they need more custodial type care. Their meds are administered, but they're not hooked up to IVs or ventilators or other kinds of equipment. The process of getting in for the hospital. Department of Social Services is typically the starting point. It might be the administrator when it's a long-term care facility. Assisted living facilities. So assisted living facilities, that's the marketing term, right, for RCFE, right? Residential Care Facility for Elderly. And those are licensed, and they can be 6-bed like what I had, and they can be 100-bed. And in assisted living, again, it's custodial care. There might be medication administration. This is where they might be taking them to doctor's appointments because they don't drive now, or to other places they need to go. But the key thing is that they're not able to get out. And that's the key thing with most of these. I'm in rehab for 6 weeks. I can't wait 6 weeks. We're closing on a house. I need to do it now. Independent senior complex. Now, these people are more independent. They're seniors. Some of them, maybe most of them, can drive, but there are those there that cannot. So they may be the opportunity there. And I didn't actually put that up on my list, but I volunteer for hospice, community hospice in my area, and I'm their traveling notary because none of those people are going to be able to go anywhere. And we do have a hospice house as well. So I either go there or I go to their home. And almost always they're in the last weeks or days of life that I help. But there is a connection that does make me money, and that is when the organization needs something notarized, they pay for that, right? When the family, everything's said and done, I took care of grandma or whoever it was, I'll get a call 3 months later, 6 months later, hey, you were here, you took care of grandma, and we have some other documents now that we need notarized. Okay, now I'm not volunteering, so I do get a lot of follow-up business from that. So that is a great thing. Transitional housing. There's other names for it. It might be called a halfway house. These are people that have been in some kind of inpatient program for some amount of time, and they're going to transition back out into mainstream America, and there's some documents that need to be handled before they can leave. Then, you might not think of this, but your doctor's office, right? Medical complexes where you have multiple doctor's offices there. These docs, they don't have time to go stand in line at UPS. You think they're going to do that? Or go to the bank? Yeah, it might be free, or it might be they don't have to pay the mobile fee, but they want it 5 minutes in between their patients. When I see doctors, I'm set to their office, I have a seat, and I wait, and in between one patient and the next, he comes in, here's my ID, okay, and I'm out. The goal there is get them done and get out. Jails and detention centers, which have recently become one of more favorite places to go. Sometimes they're called a public safety center. Sometimes they're called a detention center. Sometimes they're called county jail. I have a facility that is both minimal housing, where they've been sentenced and it's jail and they're serving their time there, and then they have another holding area while they're waiting to go back to court to be sentenced. There's also prisons. Now, prisons is a little different story. And some of them do have in-house. They don't want people coming in there. It's a little different story there. Or you have to be on the approved list. And there's a process and a training that you have to go through to get that approval. Schools. Now, nobody's living there, but that's an institution. It's a facility. And there are 2 times of the year when I get a lot of business there. That is in about the end of August when they get going back to school and they need interdistrict transfer permissions to be signed and notarized, so that their kid can go in a school that isn't the neighborhood they live in. And the other time I get a lot of business with the schools is in about May, because these kids are going on some kind of international camp, trip, something. And sometimes it's not even international, it's just another state, and there needs to be consent forms. And so I'll get groups. They'll have like an orientation meeting. And then, here I am. So, okay, 1, 2, 3, 4. You might have 10, 15, 20, at a time. I usually waive the travel for that one. Houses of worship. Again, this isn't about people who are living there, but houses of worship, do you belong? Do you belong to a church, to a synagogue, to a mosque, to something where there's a community that you're a part of? And have you taken that opportunity to, one, let people know what you do, and then number two, maybe organize. First of all, a lot of them send their kids to camps and things in the summer, so I get a lot of church work that way. The other thing is I advertise in the newsletter. I'm very involved in my synagogue, and I get a lot of business that way. So I want you to be thinking about where businesses are that aren't retail, that you almost don't think of them, because until you need to go to the doctor or you have to go over to Kaiser or whatever it is, you don't really think of those places. But those are the places that need notarizations every day. So what are my most common requests? These are my most common requests. So I've got powers of attorney, either for financial or for medical. Advanced Healthcare Directive numero uno, for hospitals and medical places. Also for the long-term care and for the assisted living. That's really the #1 document. I'm always amazed, particularly when somebody's like, I'm going to have surgery in the morning. Can you come right now? And I need an advanced healthcare directive. And I go in and they're like 80. And I'm thinking, you got this far without an advanced healthcare directive? Really? You're just now going to get one? I'm just always amazed at that. Core trust documents. So core trust documents could be power of attorney financial, advanced healthcare directive. It could include a last will and testament. There can be notarization for that. It's not the will itself, but it might be the self-proving affidavit, or it might be an attestation clause with that. And it might include a piece of property. So there might be a grant deed or a quitclaim deed with that as well. Or there could be a transfer upon death deed. So this is like 4 documents. Then just deeds. They just want to sign off on the property, and they're going to give it to those are usually transfer upon death deeds, or which I don't know if you have that in every state, but in California, we have a deed where you can say, my house when I die transfers to my son, and it doesn't go through probate or anything. It's just automatically. But until that day happens, he can't have it, he can't sell it, he can't do anything. Then renewal of medical licenses. Those are the doctor's offices and the hospitals who have an admin signed, like Kaiser's big. I could not believe when Kaiser called me to take care of a document one day on the admin side. I'm like, really? You don't have a notary to take care of the docs? No, we had one a long time ago, but she left, never got another one. She said, you know, we'd really like to have one notary that we could call. And so they said, are you willing to sign a contract with us? And I became the one contracted notary for the Kaiser Hospital admin in Modesto. Yeah, so patients could still call another notary for them, but anything admin, I was the only one. And so I agreed that I would not take money at the moment. I would let them go through their invoicing process. And I'm still approved for that. Recently, I had somebody come into one of my classes in Modesto who said, oh yeah, I'm with Kaiser, I'm going to be a notary. So they finally figured out it's going to be cheaper to pay for somebody than to have me keep coming in. But that's okay, because guess what? He might be sick, he might be on vacation, he might be otherwise occupied or busy, he might quit too, like the other one did. He might let his commission lapse and have a gap. Look at all those opportunities for me. So I'm not worried about it. Okay, and I already mentioned about permission for minors to travel. Oh no, this is different. Without a parent. So what happens is I end up going to a facility because one of the parents maybe was in an accident or whatever reason they're there. The other parent is going to be traveling with child or children who are minors, and they need a document that's been, gives permission from the non-traveling parent. Or perhaps neither parent is traveling because the kid's going to stay with grandma for a while in another state or even out of the country, and now both parents need to sign to give permission. So I get a lot of those. So these are my most common requested documents. There's one I don't know why I didn't put it here yet, but the other one are tow yard consents. I do a lot of tow yard. They're in an accident, they can't get into the vehicle, their stuff's in the vehicle, they need their brother, their friend, their mother, whoever, to go into the vehicle. They can't without a signed notarized consent to do that. So I do a lot of tow yard work, yeah. All right, so I've talked a little bit about what kind of facilities I go to. I've talked a little bit about what are my most common requested documents. Not that there aren't others. I get lots of surprises, but those are the ones that are pretty repetitive. Let's talk about medical facilities in particular. because you really need strong notary skill in there. First of all, let's talk about this alertness and awareness, right? Where our signers should be alert and aware. And what does that mean? I have notaries who are like, look, if they can tell me they want to sign it and they can hold that pen, I'm good. And then I have notaries that, I've devised a test. And if they can tell me this, that, and the other thing and all these other things, then maybe I'll do it. And so I see it all over the place. And wouldn't it be nice if there were 1 or 2 or 3 just easy things to assess whether or not you're comfortable to move forward? You're going to be dealing with medicated patients who have had maybe some kind of trauma, like an accident. They may be in there because of a disease state that's at a point that they need hospitalization. And of course, this all brings on family drama. And you've got it all going on at the same time. So you really need to assess what's happening when you get into that room. Just looking for negative signs that they're not alert and aware. So you assume they're alert and aware, and then you look for the things that tell you, oh, maybe they're not. Like they're confused, might be one. It doesn't mean they can't sign tomorrow. Maybe they're just on medication at the moment. They just got their dose, and they're going to be loopy for a while. And so I might have to come back before the next dose or the next day. Another thing might be that they are unable to talk to me directly, not through the family members, right? I had somebody who says, I don't remember, squeezing the fingers or blinking the eyes. It was one of those two because he was on a ventilator. I can do that, all right, but I need to know that it's a real blink, not I got something in my eye. And I need to know that the blink was like in response to my question. So I can't have the family on the other side of the bed saying, oh yeah, see, he blinked, that was it. That was the yes. Like, wait, I didn't see a blink. Could we do that again? And could you maybe move over there? Because I need, this is my space right here. And I need direct communication with my signers. So if they can speak with me and they're willing, that's the other thing. They might be alert and aware, and if I just asked a question, so did you want to sign this document? Because remember, it's of their own free will and deed. Right. I don't want to sign it. I don't want to sign it. There's something happening there. Now, maybe it's not untoward. I don't know. But if a signer tells me they're really not wanting to sign it, I'm going to be stepping back from that. I'm not going to get into that. The other thing is they need to be conscious. Okay, so I had a call. And this was in the days when I wasn't as good at screening the call. I was like, yeah, I'm on it here, I'm coming. And I get there, and I'm like, this person doesn't seem to be awake. And they said, yeah, he's in a coma. And I said, oh, well, how is he going to sign his name? Oh, we're going to help him. I said, well, he needs to be awake. I can't notarize for somebody in a coma. How am I going to ask him questions? Well, he wants to sign it. I don't know that. I'm glad you do. But yeah, so they need to be coma patients, not good. That's not where I want to go. So you need to be comfortable to walk into situations like that and be able to quickly assess the situation. Are they going to be able to communicate with you? Do I have pushy family members? If I don't and they're quiet and they're kind of just doing their own thing and letting me take care of it, I'm okay with them in the room. I don't want to disrupt what's happening there. It's not a happy time there. But if they start answering for my client or trying to push them, we talked about this 10 minutes ago. Go ahead and sign it. She's got to go. She's got other appointments. This is not going to proceed. Then I'm going to ask them if it's okay. I ask the patient, is it okay if I ask them to leave the room because I would like to have a private conversation with you. So you need to be comfortable with that. This work is not for everybody. Some people are not comfortable with that, and if you're not, then don't go there. Let a notary who's more comfortable with dealing with that situation. And I don't have a test per se of any kind, but I do know that if somebody knows who they are and they know what they got and they know who you are in relation to them, like I'm the notary, not their long-lost daughter, I'm pretty confident that this is pretty good. I don't need to say, so who's the president right now? Some days I don't know who the president is. I'm sick at home or something. I'm not oriented anymore. What day is it, Tuesday? I don't even know what day it is today. Those are not good, You want to just have a conversation and get a feel for what's happening there. Now, you need strong identification knowledge. So you need to know in your own state, if they don't have the ID that I'm required to take, what are my other alternatives? So many states have one credible witness. The problem is, you got to know that person, right? Some states have two. We're one. There's quite a few others. Florida, you're two, right? So then they can have two anybodies that know them, that are willing to come to the hospital and be there together. Then I can do it that way. I do hotline work, and I get people calling every day that, like, they don't have a driver's license. Is there anything else I can take? And I'm thinking, you don't know if you can take other IDs? Like it says all federal IDs or all state IDs that have a photograph and a signature. So it's really important that if you're going to do this kind of work, you are familiar with your own state's laws about what your IDs are. So you don't have to be calling the hotline from the hospital to see, what do I do now? And then what if they are unable to sign their name because either they're hooked up to too many things, and they're going to be hooked up to stuff, or because of the trauma, their hands are broken, or they're in a disease state that their hands shake, like Parkinson's. There's going to be reasons why they may not be able to sign. And if that's the case, then what are your state laws surrounding signature by mark and witnessing of that mark? Also, you want to know the hospital's policies about who can witness such a thing, because you think, oh, I can just grab anybody. But a lot of times, anybody who's an employee or staff, they will not witness documents. So if you're going to grab somebody, it's somebody visiting somebody else. That would be the case. Or in some states, you have proxy. They actually allow either the notary to sign as the proxy, and there's a signature format for that, that allows somebody else to sign on behalf of that signer because they're unable to sign. And that's kind of what it says. Joe signer who's unable to sign his name asked me to do it for him. But you need to know, because not all states have either one of these. And some states say, I spoke in Kansas, and they don't have a signature by mark, because even if they just made a squiggle mark, that is the signature. It's about intention. So if they intended to make that mark, that they accept it as a signature, no witness is required. So whatever it is, I want that. I like that. Witnesses are a pain. In any case, these are things that are going to come up almost every time, at least one of these. So make sure that you're strong and confident about doing that. Also, if you're in a hospital, there are other issues happening that you need to be aware of. First of all, there's confidentiality concerns and HIPAA rules. So you want to be careful about what you see, what you don't want to be seeing too much or hearing too much. You want to be careful about what you ask, say a nurse or a doctor, because they may not be able to share that information with you. Is there a medical order in place or a conservatorship that would prevent this person from signing? I don't need to know what's wrong with them. I just need to know, is there a medical order in place that this person should not be signing? Or a conservatorship, because if they're conserved, they're no longer able to sign for themselves. So I thought, you know what, that's a better way, because all I'm asking is for the order, and the other one's a court order. So there's either a doctor's order or a court order, one of the two. And that helps me because then I'm going to write it down about why I rejected the notarization. In my state, Secretary of State gets very grumpy when I say no to a perfectly legal notarization request. So I need to be careful when I say no. Took it out, actually, the slideshow, is psychiatric centers and behavioral centers. So yeah, I used to go there, and after 3 times, I said, I'm not going there anymore, because nobody's in their right mind there, right? Except the workers. So they're in an altered state. That's why they're there. So the family's like, no, whoever said it was okay, and I've got to pay his bills, and I need this power of attorney. So I go down there, and like, no. He cannot sign anything until he gets out, right? Maybe outpatient or something that says he's not in an altered state. So yeah, stay away from the psychiatric centers and behavioral centers. All right, so be prepared for patient accommodations. So there's physical impairments. Now, this could even be outside of facilities, but you may run into it more often in facilities. So I've had blind clients, deaf clients, unable to speak clients. They're hooked up to something. And so you need to be comfortable with that. Now, blind signers, my own mom's blind, so I knew how to handle that already. And there are some states that require you to read the document. There's a state where they have to actually read verbatim everything in it. California, we just need to say, this is what you're signing, this is who you named, and here's where you're going to sign. Now, I have a card for blind signers that I carry. It's one of my extra tools. And it's about the size of a business card. Then there's an opening in it for the signature line, and I place it there. I help them put the pen where it's got to go, and then they just do their own thing. You know, I got that from an independent living center. Google independent living centers, because that's usually how you find them. They're very inexpensive. And then you're going to need to assess the room for accommodations. So they've got an IV over here, and then they've got some blood pressure cuff over here, and they got stuff going on all over the place. They're wearing a little gown, which, you know, doesn't cover a whole lot. So one, you know, it's difficult, but you want to try to help maintain their modesty if possible. You want to make sure that you go to the, you know, what side is usable for that before you just come on over and lay the stuff on their bed. Here, you're my table. Just lay it out on them. Also, sometimes I have to go into isolation rooms. So when I have to go into isolation, the hospital will provide me garb for me, but what about your tools? Yeah, no. So I keep an extra, we have to thumbprint in California, so I keep an extra thumb printer that I use it halfway and then I stick it in a pocket. And then when I have to use it on somebody's isolation, they use my thumbprint, I throw it out. I'm done with that one, I'm on to my new one. I keep sanitary wipes to wipe down my book, and I use a hardback book because it's a little easier to do that. And then on the inside where they touch the page, that page is done, right? I'm not doing any more notarizations there. I flip to the next page for the next signer. I use giveaway pens for them. I don't need the pen back, my gift to you. So anyways, some things to think about to just protect your tools, not just yourself, when you go into that assignment. I want you to think about pricing for yourself. You know, if I go to somebody's house, I say, oh, it's going to be this much for travel, this much for the notarization. We're done. I don't have to think about it. But when I go to a hospital, you know, the parking is in the South 40. Parking may cost money. Then you got to walk to get into the hospital. Then you get into the hospital. You're still not done because now you got to check in. Now, some of them are getting more. Mine is getting more. You have to check in. They've got my photo on file. I have to have a sticker with my photo and who I am and where I'm going. And then I've got to go up 3 or 4 floors and get over to the room. And of course, as soon as I finally get everything set and I'm ready to go, who comes in? The nurse. Time for vitals. Okay, that doesn't take very long. And if that's the only interruption, it's not a big deal. But that's not the only interruption sometimes. They come in with that portable chest x-ray deal. I got to step out. Doctors on rounds just happen to be showing up when I'm there. So I do a lot better job of screening who's hiring me, and I start asking these kinds of things. Are there going to be any procedures scheduled that day for your loved one? When is it going to be their next medication time, if you know it? Because I want to be as far away from that as I can. Is there anything, are they going to be transferred? Is there anything that you can tell me to make sure that when I come, it's a good time for them? And of course, I balance that with what's a good time for the hospital. Shift change is not a good time to go there. This is like they're coming in and out of the rooms, they're trying to get done. That's a bad time to show up. So just remember, you might have to add on a little bit for those accommodations because it's going to take you more time. If it's a long-term care facility, in my state and in quite a few other states, there's an ombudsman requirement, and that is for advanced healthcare directives only. And that's a special kind of witness that has to have a conversation with the patient first, make sure this is what they want, maybe even help them fill out the form before I can come along and do my part. If I notarize it without that piece, it's invalid. It won't be used. When you're in that kind of facility, make sure. There's some non-notary tools that you need to consider to have in your bag. One is special pens for arthritic hands or hands that maybe are damaged because of an accident. So I have one, sorry I forgot to bring it, but it looks like a Y pen. So it's a short stem here and then it goes like this, like a wishbone, because then they can hold the pen like they don't have to close their fingers around it. A clipboard. Every notary should have a clipboard because whether it's because it's the big rig driver asking you to pull over or it's in a hospital. Have you ever tried to use the hospital table? It's got breakfast on it. It's got the flowers on it. And have you ever tried to stamp on it? Guess what? Yeah, it doesn't work so good. So don't plan on that. I always keep cheap readers from the dollar store. Usually about a 1.5 power is about good because all they got to do is see where to sign it. They can't find their glasses. They don't have their glasses. They are so happy that I say, oh, I got an extra pair of readers right here. Just pull them out of my bag, let them use them. I already mentioned the signature card for the blind. So I want to get into a little bit about the approach so that you start having some ideas. So what are some things you can do to bring value to the facility before you go there and say, I want your business, right? Go have value first. So do you volunteer there, or could you volunteer there? So they start to get to know you and you're on the inside. Can you offer an in-service on the notary process to staff? I did that for my hospitals, talked to the social services, went to one of their staff meetings and said, look, when you call me, here, they need to have ID, they need to have a document, they need this, that, and the other thing. Otherwise, tell them they're not ready for a notary, right? So that they have a little education. So maybe you could help in that way. Can you provide a seminar to residents? So I have a seminar program like 30 minutes long, and I go, they're always looking for program topics, you know, at these senior facilities. Sometimes it's on advanced healthcare directives, sometimes it's on other things. I talk about identification fraud issues that particularly are related to seniors. So I have topics that would be of interest to them. And I'm not there to sell my notary service, I'm there to be of value to them first. If it's a house of worship, it's good if you're a member there. I'm not saying I belong to a synagogue, so I don't belong to all the other churches. But I'm involved in my own community, and so I do get business from being involved and by helping my own community first. Now, what do I do with the churches? I go and I say, hey, do you have a brown bag lunch that you do maybe for your seniors? Would you like me to come and talk about XYZ? Are you connected to somebody on the inside? Maybe your neighbor's a nurse at the hospital. Maybe you know somebody. Maybe your friend's a doctor. If you know somebody on the inside, talk to them about how you can get to the inside. One of the other things I did is, of course, I told you about that networking group that I was a part of. And so they also need topics, and I've spoken for them. Even though I'm no longer part of that group, they've called me back several times to talk about notarization in the hospital. Key contacts that I tend to work with would be in the hospital, director of social services, or at least even one of the social workers will do to get started. When it's long-term care facilities, it would be the administrator. I do not go there with my business card and say, hey, I'm a mobile notary, I could take care of your clients, here's my card, because you know where that card's going? That's right. So I'm here, here's my approach. I'm here because I want to learn about how I can be seamless or transparent as a part of your treatment plan for your residents or patients, so I don't interrupt anything. So if you have house rules, like don't come at shift change, or maybe don't come at lunchtime, or maybe would you check in with somebody before you go to the room? I'd like to know that. So I'm not there to ask them for business. Basically what I'm saying is I already come here for business. I already know I'm coming here for business. I'm not here for that. I'm here to understand what your house rules are. I'm in your house. So how can I do that without interrupting the flow of treatment that may be happening, or even just the custodial care? So that's really important, is that when you go into somebody else's home, you want to know, how do I do it without offending, without breaking rules, without creating any kind of havoc for them? So understand their business better and make sure that you understand what it takes to come in to that business. All right, and then the last thing is jails. So first of all, many of them have websites and they have orientation on there. They'll tell you professional visits, that's what you are. Attorney, notary, professional visits. And so what are the rules for that? And again, are there certain times that I'm not supposed to be there? Women in particular, men I don't really think it's too much of an issue. No open-toed shoes, no bared shoulders, no strappy tops, no earrings or jewelry of any kind. You cannot, everybody, you cannot bring in your whole bag of stuff. That has to stay in the car. I can't bring in my phone. I can't bring in anything except my document that I'm going to deal with, a pen, my thumb printer, my journal, my credentials. My credentials mean my driver's license, and I laminated my notary certificate. So then I put it in my journal when I walk in, right on the window. She's like, okay, give me your ID. They exchange it for a badge, visitor badge. I'll get a sheriff for you. Have a seat. And then you go through the metal detector stuff, and they escort you to where you've got to go. So only certain notary tools. Oh, and a certificate if it's not on the document. And of course, I bring readers for myself, but sometimes they might need a reader, so then I just share my reader with them. So if anybody's nervous about going to the jail, first of all, you're escorted, they're with you. You get a room where you can sit down, just like an attorney would, to take care of those documents. Who's hiring me for the jails, right? Because, the inmate's not calling me, right? So 2 groups of people are calling me. The criminal attorneys representing them, and they need documents. Sometimes I go with the attorney, sometimes they just send me. And then outside family. Why are they calling me? They're calling me because they need permission documents for the kids. They can't appear for the marriage license. We got a lot of that. Deeds, because they're going to have to sell the house. Or they're having to put the house up because of bail, whatever it is. Those are the kinds. Tow yard, again, comes up a lot for me. So there's only about 4 or 5 documents that come up over and over again. So when you learn those 4 or 5, you're an expert pretty quickly about how to deal with that. Prison, I'm going to tell you, prison's a little bit different deal. It's not as easy to just walk in there, and they usually have either some kind of training or something you need to go through to get like a pass, and then you're like on an approved list. The jail stuff isn't like that. And sometimes the prisons will just have their own because they don't want outsiders, coming in. So yeah, don't bring your purse or your cell phone or your notary bag or anything that would set off the metal detector. You don't need anything else, just what you need to notarize that document. That's all you want. Inmate, it might be the inmate ID like a wristband. Prison, it could be an inmate card. You might have to use credible witness if that's not on your list of acceptable IDs. Check the outside family to see if they have their outside ID, because they might. In California, before we were allowed to take the ID bands, because now that's what we do. Yeah, before that, when that wasn't allowed, we needed credible witness. And so we used the sheriffs and said, okay, does somebody here feel like you know this guy and you'll tell me he's so-and-so? And they'll say, yeah, I'll do that. No problem. And then now, and in other states, I've seen that on the list, is that if they have a jail wristband, now mine in my county has their photograph, it has their name, it has a booking number, and if they have any AKAs. So it's quite a bit of stuff that's on that wristband. Some wristbands will just maybe have their name and a number. But whatever it is, it's acceptable. I just collect. And of course, there's no expiration date because, it's current. I'm visiting them at the Hotel California. Make sure that you're going to facilities not asking for business. Go there to be of value, to do research, to learn about their business, so that you can figure out how you can add value and how you fit into that scenario. Chamber meetings, bar meetings, if you want to try to go after the criminal attorneys to get to meet them, see if you can speak at one of their meetings. Actually, all these other ones that I talked about, house of worship, friend of a friend, you know what? Everybody knows somebody who had to go to jail for something. You know what? I do get called by bail bond agents. Now, if you've got that system in your state, they put up their house maybe. Deed of trust is usually what I'm there to notarize, and I don't go to jail for that. I go to the bail bond office. They usually have a notary during the week, but I get called Saturdays, Sundays, evenings. That's when they ask me to come in. So they're kind of another good connection if you haven't thought about them. And because other notaries in your own network, I did not do jail signings for a long time. I pushed all that work to somebody else, and she got all that work. And finally I thought, I'm giving away a lot of work. Maybe I better try this myself. And after 2 or 3 times, I thought, why did I give away all that work? I could have been doing it because jail work pays a little higher. Again, you've got more time involved and nobody else wants to go. And then online presence, how do they know I go to jail? They know because it's on my Yelp profile, it's on Google My Business, it's on my website, on the Yellow Pages, on my Facebook page, it's on every notary registry. Signingagent.com, 123notary.com, notarycafe.com, notaryrotary.com. You have a profile, it says I go to jail there. So everywhere I am, it says I go to jail. All right, so that's how they know to find me. You don't need any special certifications. You should do some additional research and interviewing and some training if you need it for additional skill sets if you don't have it. Remember, you might need some extra tools, not just your notary tools in those hospital settings. A lot of the visibility is online. That's how they know to call you. Notary who goes to a hospital, right? Notary who goes to jail. That's how they're searching. Building those relationships one at a time. It starts slow when you build. Okay, I believe I'm out of time, but I'm happy to help you. Thank you. Thank you.